How to administer fluids to your pet at home. What you will need is a fluid bag, administration set, and needles. Make sure your needle is facing with the bevel, also known as the opening part of the needle upwards. You will insert at a 45-degree angle. This will allow the fluids to flow through the tubing. When unclamped, you will be able to move your roller clamp to your desired position. This also allows the fluids to flow. When clamped, you will feel resistance. Remember to always replace your needle and twist new needle onto line without contaminating needle or line with any surfaces. This is an example of a setup for fluids. This should be done in an isolated room to avoid interruptions. Depending on the size of the pet, you can set up on a table or floor. You can add a bed or blanket for comfort. The most important part is to have the bag above height level to allow flow of fluids. This can be achieved with a hook or hanger or another person holding the bag up. You will tent the skin in between the shoulder blades, which creates a pocket. This is where the needle will be inserted. You may need another person's assistance in keeping your pet still. This is an example of the most common form of restraint. Other ways to keep your pet still include a bed or treats, or lick mat with your choice of topping. Use your non-dominant hand to tent the skin. Use your dominant hand to insert the needle into the pocket. You'll feel resistance followed by release of pressure, following the same angle. Keep inserting the needle until no longer visible. After needle is securely inserted, unclamp to begin flow of fluids. Hold the needle in place to prevent needle from falling out of place. The drip chamber will tell you how fast or slow your fluids are going. Redirecting or moving the needle up or down may help your fluids go faster if dripping slow. Stretch fluid bed from both sides to see how much fluids have already been administered. Follow the lines on the bag. Once fluids are completed, close your rolling clamp and place gauze or tissue where the needle is and gently remove needle from skin. Cap needle immediately after removing by using the one-hand scoop technique. By placing needle cap on flat surface, hold needle in one hand and gently guide needle into cap. Push cap needle against firm surface to connect. This is done to prevent self-injury. Then gently hold pressure for 30 seconds. After holding pressure, check to see if your pet is leaking any fluids or blood from where needle was inserted. Use hydrogen peroxide to remove any blood from fur if needed. A small lump may be noticeable at the injection site. Gravity may also cause fluid lump to travel, which is not a concern. Fluids should absorb within a few hours. Now you've successfully administered fluids.